Wonderful. Okay, well, hello everyone, and welcome to our first Digital Inclusion in Healthcare webinar. And my name's Ollie Sleeman, and I'm the co-founder and director at Healthwave. And I'll be your host for the next hour. Healthwave is a technology-enabled research consultancy with a mission to increase digital inclusion in healthcare. And we're gathering rapid insights and supporting decision makers all over the country. And we know from the people that are registered here today, some are new to digital inclusion, some are sort of experts, just wanting to find out a little bit more, and some have a general interest. And what we're hoping to do is appeal to all of those audiences here today. Just quickly, we'll do some introductions. So today you're going to hear from Dr. Chris Archer-Brown. He's a digital specialist powerhouse working in this field for many years, and he'll be navigating us through the latest thinking on this hot topic. Our very own Dr. Rehan Simons. Rehan has been an NHS clinician working in the front line for over 20 years, and he'll be talking us through some of our own work which we're doing to help tackle some of the issues around digital inclusion. And we're also going to hear from Rosie Atkin, who is an ICS leader, and she's been working hard to transform healthcare services in Nottingham and Nottinghamshire. So I'm going to hand you over to Dr. Chris Archer-Brown.
Thanks, Ollie. Oh, thanks, Ollie. Thank you, everybody. Nice to meet you. I can't see you, so forgive me if there's a lack of eye contact, but I'll try my best around Zoom to figure that out. I think we have lost the slide. Slides are back. Thank you. Bear with me 1 second. Excuse me. Sorry, that through my screen very slightly, and I apologize. Okay, so this is a topic that I've been working with, as Ollie hinted, for a number of years. I've been involved in technology and digital development since the 1990s, so it has been a long time. And latterly, as an academic, and I did my PhD in a university in Bath in around 2010, where I was looking at adoption of and influence in social media, so have been working on adoption and digital issues, both as an academic and as a digital innovator for a number of years. So. In this part, what I'm going to do is reflect on a paper that I authored on behalf of Healthwave, which was actually in response to some of the questions that Healthwave's clients were putting to them to say, look, can you help us unpack this issue of digital inclusion, or more importantly, I guess, the converse of that, digital exclusion, and how we can work better in our communities to ensure that everybody gets equal access to these wonderful innovations that are happening. So I'm going to talk through some of the key findings from the work that I did on that paper, and Rehan is going to hop in at certain parts where he can give specific examples of things that that relate to those issues that have happened with Healthwave's work. I guess we can't really talk about this topic without reflecting on the context that we're still in, hopefully towards the end of, but undoubtedly still very much which is this context of COVID. And I hope you can see the slide clearly on your screens. This is something that I picked up from McKinsey on a paper that they published during lockdown. And I thought it exemplified this notion that we're all quite familiar with, which is that COVID has been a digital strategy accelerator. The things that businesses have been aiming to do for a long time have been really sped up during that period. So from my personal reflection working in a university when the first lockdown hit. I was working quite happily in a 100% on-campus provision university on the 17th of March in 2020. And the following Monday, I was working in a 100% online environment where we'd flipped everything completely over the period of 5 days. I'm not saying that we did that as well as we would have done that in the 3 to 5 year strategic plan for digital adoption that the university had at the time. But that was the kind of speed of change that we had to deal with. And this chart, I mean, McKinsey make wonderful charts, but they do need a little bit of unpacking. So bear with me as I just kind of highlight what this thing is saying. But this chart is giving you an example of the change in number of digital transactions that have happened between that period of December 2019 and July 2020. So if you go back to the left-hand side of those 4 charts there's global and 3 geographical regions, you'll see that there wasn't much growth in digital transactions between June 2017 and May 2018. Some quite significant growth through to December 2019, which would have been the normal kind of growth, I guess. And then in that 6-month period, the number of transactions changed dramatically. So that's one perspective of looking at it. The other perspective is highlighted in the call out to the right there, which is that there is in the same report a similar chart that tracks the number of services or products that were translated to fully digital. And in that case, the change is even more stark. And in the calculation that McKinsey have done, they reckon that that's a 7-year acceleration in the global element. So what that means is that some of the things that we were used to doing in December 2019 in person, many of them have changed to be at least partially, if not fully, digital. And of course, one of those key areas that's affecting is healthcare provision. And any of us who's had to consult with our GP during the last maybe 18 months will probably not have done so in person, and would have done so either by phone or Zoom conversation. Okay, Ollie, next one, please. All right. So there's pros and cons to that, of course. In some ways, that kind of excites me. I think that that's a fulfillment of work that people have been doing. There are all sorts of advantages, both socially and from a health perspective, to us being able to have more flexibility in our workspace. I'm not going to get into a huge discussion over the pros and cons of working from home, but lots of us are finding that the commute is now a time that we can spend much more productively doing things that we'd rather do than spending, an hour to 3 hours in a car or a train every day. So those are some of the advantages, but of course they're not available to everybody ubiquitously. And hence the reason why we think about digital inclusion and its converse of digital exclusion. So it's a tricky thing to measure, and it includes terms like digital participation, digital literacy, digital capabilities, and is highly correlated between social inclusion or social exclusion as well. The Venn diagram that I'm showing on the chart there is probably, in my opinion, one of the best ways of being able to talk about this issue and the factors that make up digital inclusion. So, but even those need some fairly significant unpacking. So let's start with digital skills. So these are essentially a form of human capital, and like every form of human capital, there are multiple different dimensions. And in this case, there's the external versus the internal perception of skills. And the internal perception is super important because we're talking here about self-efficacy. It's the confidence to be able to use the tools. I know I've had conversations with both my mother and my mother-in-law about, no, whatever you touch on your iPad is not going to ruin it. Don't worry about it. Don't worry about being able to have a go and try these things. But those conversations are sometimes quite difficult to have. At the other end of the age spectrum, and we'll talk about generation a bit more later, but at the other end, we tend to think about digital natives, i.e. those being grown up and don't understand a world that isn't almost fully digital, as having significant skills. Our assumption is that because they grew up in a digital world, they're going to just have grown up through osmosis, having picked these digital skills up. And in some cases, that's true, but digital skills certainly aren't binary. So deep gaming skills or skills in social media are not necessarily an indicator of the ability to be able to fill in a housing claim on a local authority website or even an online application for employment.
Just going to that sort of digital natives tag, I mean, I certainly was particularly guilty of this over the years where, thinking back sort of 15, 20 years, this assumption would be that, all of the young people would be digital natives and digital inclusion would be solved. Everyone would be sort of experts and it would be, there wouldn't be a problem. But, by actually working in this field and starting to understand what's really happening with these groups, that's really not the case, is it?
No. Absolutely, and and we see all the time in skills workshops and things like those. The providers, if they're new to delivering those skills workshops, are often surprised at the difference in the capabilities at various different ends.
Chris, just picking up on that as well. We recently did some research where we were speaking to young people, and they were actually concerned about where their skills would be in the next 20 years. So, what are we doing about making sure that people are keeping pace with technology? We make the assumption that because they are sort of digitally aware now, that they might be in the future. So I think there's another kind of angle to that as well.
Absolutely, and I think I think often what you see, certainly from my perspective, is that the focus on developing digital skills is a drive towards coding and development, and I'm certainly not for a second suggesting that those aren't important skills, and those really are going to, the more of those we develop, the better off for the individuals and also for the development of the UK. And similarly for other countries as well. I recognise that we don't just have UK participants here. And I guess that kind of brings me on to this next one, which is the next circle in the bottom left is about accessibility. And accessibility in this model put together by NHS Digital is viewed from the designer or the provider perspective. So it's about, just picking up the point that you made there, Ollie, it's about designing systems that take people on a learning journey with them so that they become almost intuitive in order to be able to develop deeper skills once those initial skills have been developed. But also making sure that the system itself is accessible to people with varied skills levels, but also that it's accessible to people with learning disabilities, visual impairment, for example, a range of other potential impairments or disadvantages that they have to overcome. And then the last part that I would kind of pull out related to accessibility is one related to language. So, is there a correlation between those who speak or read English as a second language with their low take-up of digital offers? Now, we're going to talk about ethnicity as a factor of digital inclusion very briefly in a second. But that's not necessarily the same thing. This is about how the language is built within the application itself in order to be able to make it easy for people to use and engage with. And then the last one, the connectivity one, in the the dominant discussion around that topic, it tends to relate to the plumbing. And that's the kind of the main thing we talk about in relation to digital inclusion. So by that I mean, is there adequate 4G or 5G services in the local area? Is there super fast broadband in the street that we live in, or the village that we live in, or the estate that our place is in? But actually what's missing from the discussion, at least from my perspective, is that kind of hidden connectivity metric, which is it affordable to all? And especially during COVID, we've heard lots of stories of families having to make hard decisions on whether to retain access to digital services when times were tight. And I don't want to over dramatize this, but there are stories, really touching stories, moving stories in the report that I kind of referenced in the paper that we wrote, where people were genuinely having to consider whether they can continue with their digital services in order that their kids can continue with their school access during COVID, or tighten their belts really around food. So certainly, you know, I think we've all felt that familial bandwidth lag with various family members on the same household fighting to keep the Zoom conversations going for work, study, and entertainment. So these are issues that relate very much towards connectivity. So those of us who are lucky enough when that kind of bandwidth lag hit to be able to upgrade the service that we had, that was a great solution, but obviously not everybody's able to do that. So what we've done on the right there is in response to something that we noticed when we were looking at the paper and finding that there wasn't really a common definition of what digital inclusion means, and obviously its antithesis as far as digital exclusion is concerned. So I'm not going to read through it now, but it's in the paper. You're welcome to have a look at it if you want. We throw it up there as a suggestion for the things that people might want to consider. And it's really important that we engage the right people to be able to measure this. And that's why we sort of started with a definition, really, because if it's defined, then we know the type of things that we can measure. But there are a couple of issues related to measurement, and the first one is really important, which is that we're engaging with the right people. And I haven't cited the paper in our paper, and I won't talk about it here, but I will talk about an issue that this paper gave an example of, which is that a very, very highly cited academic paper on the topic of digital exclusion used an online survey as its way of collecting data. And its justification for doing that was that 94% of the country where this study was carried out have access to the internet, or did in that time when the paper was there. So I'll give that a second to land. What I'm saying here is that the paper was about digital exclusion, and by design avoided the voice of the 6% of the population not connected to the internet. So on reflection, it's an easy thing for me to pick up from a colleague's paper and say that might have been a challenge, but it's something that if we are constantly thinking about this stuff, it's a mistake that we wouldn't repeat. I think the second point about measuring digital inclusion is that it's really important we measure the right things at the right depth too. So for me, the primary question that I was reading when I was looking into the stats related to this was that digital inclusion is kind of defined by the answer to the question, have you accessed the internet in the past 3 months? Now, so the answer in the UK is that 90% of us say, yes, we have done. So that's great news. But there's many, many steps between one internet access in the last 3 months and the level of usage intensity that's going to be needed, for example, to get us most jobs to be able to apply for a job in 2021, or to enjoy the economic and social benefits of fully participating in a digital world. So for me, I would respectfully suggest that one kind of key question that is the key indicator of digital inclusion probably isn't nuanced or deep enough for us to really be able to understand that properly. Okay, Ollie, next one, please. So why is this important? So I mean, there's a bunch of reasons, and you know, we can have a conversation about that at the end if we like. But I cited a prominent study by the Centre for Economics and Business Research, where they talked about the factors that digital users, or the benefits digital users receive from being connected. So they're there, they're easy to see. So it's about increased earnings. So even even those with basic digital skills are likely to earn more than those without. And that's not even taking into account deep knowledge workers, researchers, coders, developers, digital designers who have much, much more deep skills and who are likely to earn much, much more than that. They stated in their paper in 2015 that it was connected to employment, and I found a different paper from the DCMS in June 2019, and I'll give you a paraphrased quote from that, which is, digital skills are essential entry requirements for 2/3 of UK jobs, which carry a significant wage differential and account for 82% of online job vacancies. So 82% of the jobs that we can apply for today are explicitly calling for digital skills as part of what they do. So even if you're a predominantly manual worker, the chances are your work is going to be allocated through a digital system that's going to be provided to you on some kind of mobile device that you're expected to be able to navigate in order to be able to carry out the tasks that you're allocated.
Chris, just picking up on that employment point, and I think Rahan, you'll probably come in here, but throughout our work, we've seen such a strong relationship between employment and health.
Yeah, for sure. I think that we've found, especially with the changes in the NHS, with ICSs joining up local authority with healthcare organisations under one umbrella, starting to sort of really be able to explore what that means for services design, for strategic decision making, because that link between work and health is very strong. It's very difficult to access convenient healthcare without digital skills, but also to even start to, as Chris was saying, even get employment in the first place. And unemployment has extremely bad health outcomes as well.
Yeah, and equally, I mean, even in the CBR report, they talked about time savings, but also communication. And I would say that whilst I can't cite anything here, I've read reports of lots of studies that say that there's a direct connection between loneliness and social isolation and life expectancy, where the converse is true, that those who live to be 100 tend to have social connections as a core part of their lives. So there's it's not just the employment and health outcomes, it's that social connection and health outcomes too, isn't it?
Yeah, see some other savings there as well. And I mean, just we all know how much saving you can make by shopping around online, but that actually equates to sort of quite a big bit of income for people who are already very short of funds, and often are making sort of difficult decisions between having the heating on or eating well, and all these sort of really heart-wrenching sort of decisions. So this gap, I suppose, in digital skills, which we always suspected was there, has, as you've shown on one of your slides, Chris, become so acute with this massive increase in move to digital caused by the pandemic.
Indeed. Thank you. Ollie, next one, please. Okay, so there are, these aren't the only factors that relate to digital exclusion, but I think that they are some of the key factors that relate to digital exclusion. Generation in the 2018 National Office of Statistics, reports 99% of people up to the age of 30 use the internet 3 months prior, and it's fair to guess that their usage intensity is likely to be high, both for personal and professional purposes. But when we move through the ranks, it drops off as in the kind of the type of graph that you would, I guess, most of us would expect, to the point where in the 75 plus age group, this drops off to 51% of men and 37%, I should say, of women have accessed the internet. So a significant chunk of both men and women above 75 who haven't. haven't got any insights or thoughts on the difference between men and women, but I would be interested in reflections on that later, if that's something that people want to pick up on. In relation to wealth, there's a clear connection between that and digital exclusion. So 99%, coming back to this connectivity score that we talked about earlier, 99% of households with a combined income of over 40,000 are connected, but this drops down to 60%. Only 60% of the houses or households with a combined income of up to £10,000 are connected. So it kind of, in a way, has this sense of continuing the momentum of that exclusion and the differences between the two. You know, if you've got access to the internet, you can carry on and you get all of those economic benefits that we talked about just now. If you don't, it's a lot tougher. I think that's one of the areas where there's been some positive signs in COVID. I think we can all remember, certainly in the first lockdown, a significant push towards schemes of donating unused hardware, iPads, PCs, laptops, and so on, where to families who didn't have access to it so that their kids could access online school. But that's not the only problem. The hardware isn't the only issue. And I searched, when I was writing this paper, I searched long and hard to try and find a really good, usable donation system for us to be able to use to pass over data. So if anyone knows of a system where we can donate our unused data at the end of each month, I think that would be a great initiative. Or if someone wants to reach out to me and collaborate with me to put that initiative together, if there isn't one already, find me please on LinkedIn. I'd be really interested in having that conversation. 20% of non-users cite lack of skills as their main reason for not accessing the internet, and 64% of non-users say that actually it's down to lack of interest or lack of usefulness. Now, I absolutely put my hand up here and say that I lead myself towards a potential accusation of digital determinism by saying this, but it feels to me like 64% of non-users saying that there's nothing to interest them in the entire digital space feels like maybe that there's some education that can be done to give them the access to the advantages that they can access. I'm not saying that the digital world is for everybody. I'm certainly not saying that. But I am saying that probably 64% of non-users saying there's nothing there that interests me or is useful to me feels maybe that there's an education issue to be tackled. Ethnicity, I think, generally speaking, is felt to be an area where this has been a significant success, and people may have different views on this. I reported the findings from the ONS in the paper, and in there they cite an example from the Bangladeshi community where in 2014, 31% didn't use the internet, and that had dropped to only 8% in 2018.
There's a little bit of data coming through on some of the work we're doing. We've worked in East London and elsewhere in the UK, and while we are with that, the data that we're seeing certainly backs up the progress that you're referring to there, Chris. We are seeing a little hint that there's a problem with user experience or UX, and this is coming through quite consistently. It's not a strong thing. It's something we'd like to very much focus on and develop, but there seems to be a UX issue with pathways and services, especially in the public sector, that could be a sort of an area of improvement for sure.
Interesting. So then the last one, and I guess in some ways this is the big one in terms of digital exclusion, is that 56% of non-internet users fall into the UK classifications of disabled. So whilst it's reduced between 2014 and 2018, 23% of disabled adults in the UK were classified as non-internet users, versus only 6% of non-disabled. So I think that across all of those areas in that Venn diagram of digital inclusion that we could talk about, I just saw a question from Daniel Barton popping up saying, does that include neurodiversity? I think broadly speaking, the answer, so ONS refer to any neurological condition that falls into a UK classification, UK government classification of disabled. So I think the answer is that probably would not include everything that we would consider to be neurodiversity if we include things like processing issues and dyslexia, dyspraxia, and so on, then I would say probably, unless it was classified as disabled, the answer is probably no. So different numbers if you include that across the board. Okay, apologies. I just saw that one pop up and felt I could answer that one straight away. And I know there are others that have popped up, which we can come back to in a second. Ollie, would you mind slipping to the last one? So I think in conclusion, and I'm not trying to offer any solutions here. I'm just trying to sort of suggest some thoughts. But naturally, in any kind of evaluation, there is a personal dimension to this. So I will hold my hand up and say, you know, I wrote the paper. These are my thoughts. Agree with them by all means. Let's have a conversation about them if you don't. But for me, the numbers seem pretty clear. So 90% of the UK population reported that they had accessed the internet in the 3 months prior to the ONS survey in 2018, which I hope will be run again probably next year, I'm guessing, because the previous one was run in 2014. And of those who said that they hadn't used it, 85% state personal choice as their reason. So those personal choices being, it's not useful to me, I use the internet outside of the home, or I choose not to use it because it's unsafe. So the sense that from a government policy and social discourse point of view, this is considered a problem solved, I think if you look at those raw stats without digging any further, and if you ignore the points that I made earlier about how valid the questions are, this point about whether 3 months prior is a good indication of true digital inclusion, then there is an argument to say that this is a problem, if not solved, well on the way to being solved. But I guess for me, that still leaves 10% of the population that don't use the internet, and only 15% of those are stated that they can't use it. But that's still 1 million people in the UK. So yeah, if we say 67 million, 10% of those, 15% of those, that's still 1 million people. And the argument I would respectfully raise for consideration is that that's the most vulnerable members of our community. And I guess that's kind of part of the reason why that's driving these guys in Healthwave forward, in order to kind of hear those voices and help everybody design better solutions, create a world where those challenges to digital inclusion are resolved. Okay, that's it for me. I'm sorry, I think I've run over a little bit. I apologise.
Oh no, that's absolutely fine, Chris, and thank you so much for walking us through that. Super thought-provoking, and I'm sure there's a lot that people will take away from that. We'll continue to sort of monitor questions in the chat and answer those as we go. But next, we'd like to hear from Rehan and the experience that we're having within Healthwave and how we're starting to try and tackle some of those challenges using solutions of our own. My laptop's just gone incredibly slow, so I do apologise. But
I'll start talking if you like while you're.
Yeah, that'd be great.
So we've got a couple of slides for you, and it's just kind of worth stating an observation at the start, really, that what we're seeing is that digital products and those pathways that are being developed or purchased sometimes for a particular population tend to go on to have quite low use and uptake, and that's even if you've got high levels of digital inclusion in your space. So that's one of the early reasons why we started Healthwave, to sort of really start to explore the reasons behind that and how we might be able to sort of make an impact. And of course, once you're working in this space, you can't go very long without thinking long and hard about digital inclusion as a whole. And I don't know how we're getting on with slides, but if you look at the first slide here, you'll see an example really of how you can start to take a wide angle view really of a population, and before you even start to even target where you're going to get data and obtain data. And the top figure that is actually a screenshot from our digital inclusion score page. That's a Healthwave research algorithm and it uses ONS data sets, amongst others, and it puts that through that algorithm based on the latest research that's been produced by our research team, and produces a risk score for your location. But it's always worth underlining that even if your region has a really high inclusion score, there's always going to be pockets or households at high risk of exclusion. So you're always going to need a hybrid strategy. But if you've got an area with a high likelihood of inclusion, that might start to encourage you to think about focusing on digital pathways, as there may be an opportunity there. The figure below that is from Plan Spatial. They're a friendly team who we thought were doing some really cool stuff with heat maps. So their big idea is that you can support planning and strategy with visual tools like heat maps, and you can see an example there of how you can really start to visualize a wide area before you start to then sort of target where you're going to start. It's a big area. It's a big thing to sort of get through. So how you're going to start and who you're going to target. So if we move on to the next slide, we can see what this slide is all about is how we then, our next step on our process. So how do we start to use new data to target your digital strategy or activities? So at Healthwave, we use a range of approaches. We use surveying, user experience or UX sessions, qualitative interviewing techniques, and we display all of that results and analysis on a cloud-based platform to clients. And you can see a screen grab of what that platform looks like from a client perspective.
Rahan, it's probably worth mentioning there that many of the clients that we're working with, they talk about wanting to make sort of dynamic decisions on the fly. That decision making has to be more rapid nowadays, and that's one of the reasons that we're sort of starting to serve up insights almost in real time.
No, for sure. And I think we'll hear from an NHS organisation actually in Nottingham that actually did their own data gathering and research activities, which was really incredible piece of work that they did. But it took them a very, very long time. Between I think 18 months it took them. So one of the things we're really focused on in Healthwave is to really focus on how we gather that data, the efficiency of how we do that, how that's done quickly, and how you really include all of the people that you need to include in that conversation. You can see the lower part of the slide is we say to design better services, you need to have deep and rich conversations, and really that speaks to the need to involve that full cross-section of your community, of that user group being targeted in a city or an ICS region, for example. We put a lot of thought and energy into the process of speaking to the people that we feel are really often missed from that traditional conversation. It's a really key part of our process. We can't underline enough that we really feel it's so important to have a robust academic process that drives that data gathering, but that really speaks to people and that full range and depth and cross section of the community that's being targeted for digital services.
I mean, one of the things that we've observed quite a lot is the need for sort of cultural behaviour change when trying to encourage people to use digital channels. So we talk about good UX, etc. But if there are habits of using other channels, how do you start to move people to those digital channels where appropriate? And part of our approach of using kind of academic grade researchers in helping us to speak to those communities is to build behaviour change methodologies into that. And so what we do through that is start to serve up the kind of frictions and enablers to change via our kind of dashboard that helps decision makers to decide, what services or products to design, to procure, to improve, etc.
Good. All right. So this slide is all about. So we believe that research without action could present a missed opportunity, we've got some examples here of where the data and the insights that we've been gathering has informed some campaigns that are designed to increase the uptake of services and hopefully start to have that impact on inclusion. So digital inclusion is a huge issue. It's a huge society issue. It links into all sorts of areas around socio-economic politics, you name it. So we can't boil the sea on this. And there's organisations, institutions, government, third sector teams, and all sorts of people who are dedicated to this long term, the hard yards that it's going to take to improve society and increase inclusion across the board. But what we've challenged ourselves to do is to come up with some ways that start to tackle this in the short term. So some short term opportunities where we can start to make an impact. And one of the big insights that comes through from the data is quite striking. Almost 1 in 3 adults in the UK anyway, providing some sort of digital assistance or care, if you like, to others who are less included in the digital world. And really, that's a really incredible statistic that almost a third of the adult population is doing this. I mean, I expect that most of the adults on this call are probably helping somebody out, often with something online. And so this digital carer concept is really forming into a campaign that we'd like to sort of talk about. And we're doing that to really mobilise this really enormous group of adults that are already having to work hard to support others to stop them from falling through the cracks. So you can see a screenshot of a resource page there, which is a shareable page of resources that people who are engaging in this digital caring activity can go on there, and there's lots of ways they can share that learning and share those resources around skills, connectivity, kit, and all those sort of important ingredients in digital inclusion. And we try to make that so it's really, really easy to share that information as well. So that's something we can talk more about maybe in another webinar or on our LinkedIn or website. And the other bit, jump in at any stage, Ollie, by the way, and because I know you're sort of you've been really working hard on it.
Well, maybe if I sort of cover off the campaign bit, because I mean it's something that was super exciting to be part of, but there was a key reason why we start to tailor campaigns, and that's because when we started to gather insights within the community, we understood that digital products often had different benefits for different people. But quite often the communication was holistic or sort of almost like a blanket approach. And sometimes the benefits of those products didn't really speak to different individuals. And one example of that was where we worked with NHSX and ICS teams in Somerset to try and raise the awareness of the NHS app. And we started to speak to young people and find out what the benefits of the NHS app were to young people, to that particular audience. And then based on that data, we were able to help produce assets to promote those benefits and use sort of media that audience would be engaging with, for example, TikTok campaigns and Instagram, and being able to use language that they were familiar with. And I think that's super important, whether that be for young people, older people, specific groups within the community. It's really understanding the benefits to them, perhaps the challenges or barriers that they face, and then tailor campaigns around their needs.
Yeah, it's worth mentioning that the Somerset team were particularly concerned about young people. There was an issue with social mobility in that part of England, and by actually going in and talking to those young people in their own environments, we went to schools, colleges, organisations that work with young people. We did UX sessions, interviewing, all that sort of good stuff that's really started to sort of tell us what young people would want and use from NHS digital services. And that we were then asked us to produce this sort of video campaign material, which is now available for the NHS to use to engage young people, and that was a really sort of fun project to get involved with. And I think there was an issue with finding actors in the middle of lockdown in deepest Cornwall at one point, but I think it was a really, really fun and good thing to be involved with, and it's a great sort of resource that's come out from that work as well. Thanks,
Rohan. Okay, so what we're going to do now is we're going to listen to Rosie Atkins. So Rosie works in the ICS in Nottingham and Nottinghamshire, and they are doing some really brilliant work around digital transformation. Rosie is leading a number of different work streams, one of which is around how she engages with the community. So unfortunately, Rosie is incredibly busy, and she does have a pre-recorded interview. So I'm just going to share that with you now.
It'd be great to hear from you, Rosie, about the work you've been doing in Nottinghamshire around digital transformation, and also the work you did with Healthwave. As I gather, it sounds really interesting. I'll hand over to you.
Yes, thanks for the introduction, Dawn. I'm Rosie Atkin. I'm the Project Implementation Manager at Connected Nottinghamshire, and my role specifically revolves around leading the programme's Digital and Social Inclusion project. Connected Nottinghamshire programme itself works across Nottingham and Nottinghamshire's integrated care system and aims to support system-wide digital transformation through a number of different work streams. And one of those work streams being public-facing digital services. We understand that actually the majority of people that would really benefit from the online digital services that we're trying to provide to people might be digitally or socially excluded or experience health literacy inequalities. So that really means that we need to tackle digital exclusion, and it's really essential. So what we've done and what I currently lead on is a digital and social inclusion project where we have embedded schemes at scale by supporting people to get online and really become more confident and capable of using digital tools. And some of the engagement and findings that Healthwave has found for us has enabled us to really sort of pinpoint and target specific areas that we need to look at. So as an ICS, it's been our strategic vision to address the barriers faced by our population in order to improve access to services and also reduce health inequalities that people experience. So our vision to achieve this was really through the provision of digital health and care tools that connect people to the information and services that they need when they need them. So when we started our public-facing digital services journey about 3 years ago, the needs of our population were at the heart of everything that we did. We didn't want to deliver services that were siloed or didn't add benefit to people. So from the offset, we undertook co-design and co-production. And that was through an extensive piece of public engagement, which lasted around 18 months. And it really enabled us to understand the barriers and challenges that people faced. We went to places like GP surgeries, hospitals, job centres and events out in the community, to working with local colleges and young carers to really get the opinions of our local and sort of true demographic, really. From that research, people told us that they wanted a single place to access all of their health and care services digitally. They wanted support in improving their digital literacy and helping accessing digital services where they sort of struggled to do so. People wanted the information to be accessible and understandable so they could respond in consistent ways. And also, they wanted to be assured of the privacy and security and ethical use of their data. Following all of that identification, we produced our public-facing digital services strategy through partnership working with NHSX, NHS Digital, Patients Know Best. The NOTS NHS app was created, and this utilises the national NHS app as a single front door, but we've expanded on that transactional functionality by integrating Patients Know Best to offer wider access to secondary care and social care services. Obviously, the change in landscape over the last 18 months and that rapid shift to digital, it's really been essential that we continue to drive forward a continuous cycle of improvement. So our approach in doing this has been to work directly with Healthwave, who have undertaken the engagement, revalidation and user experience to understand if barriers and challenges have changed. And by doing so, this has enabled us to ensure that we align and adapt our strategic vision to these changes where necessary. Some of the completed activities that Healthwave undertook for us, they engaged with hard to reach and local community groups to ensure that we're gathering insights from end users. Surveys were undertaken. There was just over 500 people that were asked 9 questions relating to digital health and care. They undertook community mapping for us, direct engagement with organisations and groups such as farming networks and migrant communities. One-to-one interviews were undertaken, and also user experience sessions to understand actually the usability factor of the NHS app and patients know best. And some high-level insights. So from the survey, over half the people had already downloaded or used the NHS app, and 30% of people were supporting a dependent or family member to use internet services for health and wellbeing purposes. Key themes from the community engagement and interviews side of all of the work that Healthwave has been doing has given us really great insight into NHS login, online consultations, and also data and security elements. And from that, Healthwave has produced a NHS app usability report, which has been really insightful and useful for us to use and feed back to the national team. A number of considerations and recommendations were brought to our attention. So one being around that concept of a digital carer. So now, as we've finished that initial engagement from Healthwave has finished that, we're going into a phase 2 to really digging down into some of the insights and seeing how we can action all of the recommendations that were initially given. So looking at that particular one of a digital carer, seeing what resources that we can put in place to support them in the support that they provide to others. And obviously, one of the biggest impacts and actions that have come out of all of this engagement has been utilising the findings to ensure that we are aligning our strategy going forward to those needs and wants of our people.
It sounds like you've done a lot of work before Healthwave got involved, and that was really interesting. You told me earlier that you went along to GP surgeries, you went to beer festivals, that must have been a hardship, and you've generally hung out with real people to try and get some insights. But then more recently, you involved Healthwave to sort of, what sounded like accelerate really your insights. Was that one of the reasons you wanted to work with a external company and bring Healthwave in?
Yeah, definitely. I think we recognise the importance of working with experts in fields of work, really, and that's what Healthwave really is. They're experts in public and patient and citizen engagement, and the engagement that we undertook several years ago now to really start off our strategy was fantastic and brilliant, and a real sort of showcase of co-production and user design. However, it was extremely labour intensive, and obviously given the difficulties over the last several months and 18 months really with COVID, unfortunately we've not been able to do that traditional engagement that we would have ordinarily have done. So that's really one of the main reasons that we wanted to work with Healthwave, knowing their experience within this field of work and utilising their expertise to support us in supporting our population.
That's really interesting. I'm even more interested to see what comes next. It sounds really fascinating.
And we're back.
And we are back, yes. So thank you ever so much for sort of keeping with us, and we're hopeful that you'll be able to take some useful stuff away. And we do plan on sharing the webinar and some useful resources with you afterwards. We have got 5 more minutes, and my plan now is to try and answer some of the questions perhaps that are in the chat. I'm just having a look through.
There was a question, Ollie, about Dr. Archer Brown's white paper.
Yeah.
So I've actually posted a link there in the chat. If you click on that, you'll be able to access the white paper via our website. So it'd be really, really great to get any feedback you have about that. And I know Chris would be always interested to hear any feedback or any comments about the digital inclusion white paper. I think actually it was a real eye-opener, because I think that a lot of the evidence and data that we sort of have based as a nation, our strategy around this is, seems to have potential gaps or potential sort of areas that need further work and attention. So I think it was a really worthwhile thing to do, and a really fascinating piece of work for sure.
Can I just sort of hop in, because I've been really interested in monitoring the conversation in the chat as it's gone on, and I think that one of the things that people tend to be agreeing on is that point about the measure of digital inclusion not being sufficient. That point there. I'm going to misquote and misremember the person's name who wrote it, Jonathan, I think, who made the really good point that accessing an ancient Hotmail account to read an email from your children every few months isn't the same as doing the things that are going to really connect you with society and the economic world around you. And it would be really interesting to do some work collaboratively, Healthwave plus others, maybe on this call, maybe not on this call, about really trying to find a dependent variable for digital inclusion that properly does capture those points that Jonathan and others made in there. I think that would be really useful to do, to be able to kind of really pinpoint the breadth of the problem to resolve, and highlight the key issues that are needed to be invested in order to resolve that. I think really interesting for me that people have engaged with that point.
Thanks, Chris. This one might be a bit big, Rahan, to answer in the next sort of few minutes, but there's been a question around the push towards integrated care systems, and the fact that we've got health services, social care organisations, councils all coming together, and whether that is creating further opportunity for this type of work around digital inclusion, and perhaps what we see as the next kind of step to working together.
Yeah, I'm just tapping an answer there, and it's possibly not the sort of full answer that I would normally give, but I think this ICS push is an opportunity. Yeah, there are some issues with it for sure, but anything that starts to bring together these worlds of the local authority, social care, and health together, I think is a good opportunity to take a more holistic view of a location, of a population of people. Because as we all sort of know innately, but also has been confirmed by the data that there is very little separation between life outcomes, between work, care, health, and all of these sort of silos that have developed naturally over time. So anything that breaks that down and provides an opportunity to sort of start with a real holistic understanding of a locality, of a population. We'd say at Healthwave, you need to understand the people in a location and understand their motivations and their challenges before you even think about dropping in a new pathway.
Cool. We've got some people asking how they can get in touch with us. There is a contact form via the website. We're also on LinkedIn, so feel free to drop us a message. I think we've got time just to answer one more question. It was around how we delivered usability sessions. So I don't know whether, Rahan, you wanted to cover that one off.
Yeah, so usability sessions, it's a bit of a technical term, isn't it? I think in practice, like all of these things where you're gathering data from people, it's a conversation. And it's a conversation which is, yes, it is conducted by a specialist in user experience. I mean, you have to sort of have specific training and knowledge and expertise to do this. We work, in our team, we have some extremely proficient user experience specialists. But to the person or the people that are being spoken to about this, for them, it should feel like a conversation. I think that's the thing. So if you can, if you engage with a wide variety of people, a depth and a breadth of people that cover the whole demography of your location, there are things like user experience sessions which really can start to sort of add to the breadth of data that's required to build a full understanding of what you need.
Wonderful. Thank you ever so much. We will be back in touch via the contact details that you provided with a copy of the webinar and also some further resources that you might well find useful. But thank you very much, and thank you to our speakers.
Thank you.
Thank you.